Top of the morning, Dan, and in for Amy J this morning, Chicago Tribune columnist John Cass. COVID cases are up, but deaths are down. And all the emphasis is on cases being up, and thus the predicate for lockdown politicians to reinstitute some facsimile of a lockdown. California Governor Gavin Newsom suspending indoor dining at LA restaurants, telling people to stay inside for the July 4th weekend, even as there are pictures out of LA from protests that are going on, you know, the Black Lives Matter and related protests. And
that's okay.
There's no commentary on that whatsoever, other than, you know, generic support from the same politicians telling everybody to stay inside. It's a little complicated.
No, you don't understand. The virus has its own politics.
I understand.
If you're of the left, you don't get it. And if you're a middle-of-the-road person, then you get it.
Well, this is a topic that we've talked about quite a bit. Dr. Joseph Ladapo, who is an associate professor at UCLA's David Geffen School of Medicine, has an op-ed in the Journal on it. The earliest sign of the politicization of the virus. I mean, you could say it shouldn't be politicized. It's too late for that. It's happened. One of the earliest signs of politicization was the broad animus directed at protesters who objected to the lockdowns. The double standard in the treatment of those opposing draconian lockdown policy versus those protesting other matters. The double standard in treatment of the various groups was political, writes Dr. Ladapo. Of course it was. Medical experts have also lost the empathy that previously characterized their approach to public health. Many illnesses spread as a result of personal decisions and behavior. And this is why public health experts advocate pre-exposure prophylaxis, antiretrovirals for HIV protection, needle exchange programs, drug users. In the UK, e-cigarettes for smoking cessation. But this wisdom hasn't been afforded to the COVID-19 pandemic. There is little accommodation for people who avoid masks because of difficulty breathing, claustrophobia, or belief that one's face shouldn't be subject to public policing. Some medical ethicists have suggested that if ventilators are in short supply, patients who religiously use masks and adhere to social distancing should receive priority, rationing medical care to push non-compliance, to punish non-compliance, for example. I mean, these are the things that are actually happening as it becomes a matter of dogma, not science or data. And this is what Dr. Marco Siegel was getting to when he appeared on Tucker Carlson's show yesterday. Siegel is at NYU saying this.
Tucker, it's being widely reported that there's over 40,000 new cases of COVID-19 yesterday. It's been widely reported that the South and the West have been hard hit. It's been widely reported that Texas, Arizona, California, and Florida are reversing aspects of their reopening. It's been widely reported that Dr. Tony Fauci says we could see as much as 100,000 new cases a day. I'm not sure where that number comes from, but that's what he says. That's all been widely reported. Here's what hasn't been reported. As the case counts are going up, the death rate remains under 700 per 24 hours per day of new cases. Why? Why is that? Because most of the people that are getting COVID-19 now are young people. And the CDC just released a statistic that, again, was not reported, that of the last 15,000 deaths from COVID-19, only 3.9% were under the ages of 44 years old. The same group that's now spreading it in Miami or spreading it in Austin, Texas, or spreading it in Phoenix. That group has mild cases. It's been widely reported, as you just said, that the hospitalization rate is going up, but it's not reported that it's not mostly COVID-19. It's actually the cases that were there because of the reopening, because they're now getting the elective surgeries they need, cancer operations, heart disease operations, hernia operations. That they're filling the hospitals. Only the COVID-19 is actually getting in the way of that because these mild cases require isolation.
For more on this, we're pleased to be joined again by Dr. Gary Slutkin. He is a physician and epidemiologist who has led efforts to combat the epidemics of tuberculosis, cholera, and AIDS. He's a former director of intervention at the WHO and currently tracking and advising governments on COVID-19. He's also the founder of the organization Cure Violence. Dr. Slutkin, thanks for joining us again. Appreciate it.
Good to be with you, Dan.
How do you react to Dr. Siegel's summation of what is being covered in terms of public dissemination and what is not?
Well, it has partial truths in it, but I think it's missing some things. First, the hospitalizations due to COVID are going up in those places, and I think I'm hearing quite a bit of minimization of the severity of COVID, other than deaths. I mean, in New York State alone, there's at least a couple hundred cases and 1,000 cases elsewhere of serious disease in people under 20, including with cardiomyopathies and what's called Kawasaki or toxic shock syndrome. There's people who aren't dying, who aren't even going to the hospital because they're trying to manage it at home, who are spending 4 or 5 months of bad fevers, blood clots, persistent lung disease, some of them with all kinds of disabilities. So it's really a mistake to downplay the severity of this illness and its contagiousness. What I did appreciate in what he had to say is that the young people now are driving the infection rates, but there's epidemics and outbreaks happening among young people and in bars all over the place. Louisiana, Idaho, New Orleans, all over the place. And then the contact tracing literature from Washington State and Florida shows that then migrates into workplaces. It goes into workplaces or into homes. So you have people, as you're seeing, out there on the beach or in crowds, and they may have mild illness or they may get serious illness. There are young people all over the country who are on ventilators, but even those who are just fine and riding their bikes around and looking great, including in Chicago, where I live, I'm scared to death of them. And and they're carrying, and in many places they're transmitting to their homes or into their workplaces. And this is very well documented now as we're starting to see the data from the contact tracing. And it makes sense. It totally makes sense. They're convening in the bar or wherever they are, and then they bring it to others. And in other places in the world, not just in Asia, in Africa, in Europe, they've kind of agreed to much more mask wearing as a population. They've actually agreed on goals of getting rid of the virus rather than some temporary goal of bending a curve. Bending a curve is like celebrating at halftime. This is one of the problems that we've had, is we've celebrated at halftime. The virus is still here. We all wish it were gone, but it hasn't gone anywhere. And all you got to do is bring people together. They'll spread it to each other. The older people are going to go down hard. The younger people are going to go down less, but a lot of them are going to get disabilities. So I guess that's my summary of it.
Well,
Doctor, can I ask you a question? I'm just going to give you a hypothetical case. A man in his mid-60s lost a lot of weight recently. He's a diabetic. He writes a column from his home in Chicago. Should he not even see his kids who are in their 20s who go out? Is that what you're telling me? I can't even see my kids? Just tell me.
No, I can't tell you what to do that you can or can't see your kids. But I think you should be aware, if it's you that you're talking about, that they pose a risk to you if they've been hanging out.
Well, they're healthy young men, so that means they're trying to swim upstream the way Dan Proft teaches them. But you're telling me I can't see my kids, right? That's what you're saying.
No, I can't tell you that, but I can tell you that they're a risk to you if they've been hanging out with others, no matter how healthy they look or their friends look. And that's, this virus is really bad in the fact that people can look well and still have it in their mouth. And their friends can have it in their mouth, John. This is John Kiss, right?
Right. Yeah, I was just
Yeah, I'm
asking
really
for a
happy to
friend.
be with you. I have
you,
so
sir.
much respect for your writing, and we've never spoken.
Thank you, Doc.
But this is really the bad news, and it's counterintuitive. You can't tell who is carrying it, and it is just in talking is about as bad, and in terms of aerosolization, it's worse than coughing. I mean, they've done this with droplet studies. You can listen to the way I'm talking,
Right.
or just saying stay healthy, and this produces droplets. Now, if you're going to see your kids, best, John, or if this for anyone who's listening, outdoors, and you're both wearing masks, and you're more than 6 feet. Sorry, and that's
What
really.
about those ethnic, the July 4th, which is still legal in this country, where immigrant families, Greeks, Jews, Poles, everybody, we sit around the table and we fight about Roosevelt and Truman or whatever they did when we were kids, and now we argue about Trump and Biden. We can't have that conversation now. We can't sit around the table, which is the university of all the young in many households.
If you're outside, again, I can't tell you what to do and what not to do, but it's you put yourself at risk when you're closer than 6 feet. The further you are, the less the risk. If you're both wearing masks, it's better. I'll also share with you that talking softer is safer than talking loud.
Did you ever see a Greek talk soft? Did you ever see a Greek talk soft?
Well, here's the story. Every epidemic, and I've been working epidemics since 1981. Every epidemic requires behaviors to change, and no one wants to do the behaviors that need to be changed. I mean, AIDS. People were. You mean only one or two sex partners, not 5 or 6? That's no way of living, I was told in Africa. Or wearing this thing, a condom. This is not. No one wants to do that. When we're doing reduction in violence, don't do the shooting. This is a change in behavior. Ebola, how to bury somebody, or whether you can actually take care of your mom. Behaviors have to be changed in an epidemic, and this is the most serious and most contagious. Not the most contagious. Ebola and SARS are more contagious, but in terms of prevalence and being everywhere, this is really serious stuff, and we have to accept that we have to change our behaviors and we're hanging in there. We're hanging in there, John, until there is better treatment, earlier treatment, or a vaccine. And people haven't, you can't take it back. You cannot take the exposure back. You can't take the mistake back.
So
in there, be safer.
So doctor, let's just provide some context here. 1% of the American population represents 50% of the deaths. The CDC suggested that only 7%, 14%, only 1 in 7 deaths reported was COVID solely. In other words, no comorbidities, no other contributing factors. 1 in 7. 1%, 50% of deaths. You look at the Florida numbers, since Florida is all the rage for the media right now, and the Florida numbers, people under the age of 55 represent less than 1/4 of all hospitalizations and less than 1/5 of all deaths. So I'm not suggesting it's not serious. That it cannot be serious for younger people. It certainly can. Whether you have comorbidities or not, you can not die, but also have lasting impacts from the virus. I will concede all of those points. But the idea, I should say, the discussion is about what to do about it. And the lockdown policies simply don't bear out in terms of sense. We look right now, actually, the American Institute for Economic Research did a review of the 8 states in this country that did not lock down or had a light touch versus the other 42 that did or had a heavy touch. And the non-lockdown states had half the unemployment rate and 1/4 of the deaths. The deaths in the lockdown states were 4x those in the non-lockdown states, with New York leading the way, even as Andrew Cuomo is somehow lionized, while he and other governors like Whitmer and Pritzker and Baker and Murphy sent infected people back into nursing homes, the most catastrophic decision arguably that has been made by any politician. And yet we're still talking about how that it should be reported. Anybody who gets infected should be reported breathlessly like it's a death sentence. And it's not a death sentence. 99% plus of people survive and live to fight another day. I mean, that context is important, isn't it?
Dan, let me just throw a few other things into this. The comparison of states was largely having to do with rural states that were unlikely to have as serious of a problem as a place like New York or Chicago or Los Angeles, which are heavily crowded places, and they're going to need more behavior change because you don't need that much behavior change if you're living out on ranches and stuff like that already. So let's just put that as a place marker in terms of that comparison. The other is that we're so early in this. Like these cases of toxic shock syndrome and cardiomyopathy in people, in kids and teenagers, showed up in New York State in the next group. It showed up later. The same thing happened with flu, the 1918 flu. The older people were first, and the younger people got into the serious problems later. We're in a very early stage of this. And so, when we use these words like lockdown, it sounds very scary. And so what I'm saying is, and I think Illinois and Chicago are doing this fairly smartly, is that they're watching the numbers very close. But see, when something starts to go up, it then starts to go up really fast and then even more fast. And so this is the phenomenon of invisibility and exponential growth. And before you know it, your hospitals are really jammed. And people who listen, I know people who have died. I know parents of people who have died.
Okay.
I've had people on my staff who said, I can't breathe. I've never been so sick in my life. This is not a distant phenomenon.
No, we've reported those stories. We reported those cases. I'm not trying, as I said, I'm not trying to minimize how damaging the virus and lethal the virus can be and has been. I'm just saying the entire context, because what we're talking about is the public policy decision making. And I mean, you were at the age, and I'm sorry I'm exercised about this, but I'm just sort of up to my limit with some of the reporting on this and some of the fact-free pandemonium that is being engendered. I mean, you were at the
We're all getting distracted. We're all getting distracted.
Wait, Doctor, you were at the WHO. You were at the WHO, and you have the infectious disease point person at WHO come out the other week and say, there's basically no evidence or very little evidence that children transmit the virus. And so in the context of reopening schools come the fall. And then, she is excoriated by a particular political cohort and, walks it back in. And then there's, if it's scrubbed from the WHO website, what she said. I mean, is she an infectious disease expert or not? Was what she's saying based in fact or not? So the silencing of dissent and the narrow casting of information seems to me always calls into suspicion the person doing it. And the people doing it are those that are advocating draconian policies. By the way, you're saying Illinois did a good job. Pritzker was one of the governors who introduced infected people back into nursing homes. It's idiotic.
I think that all of us have gotten distracted when we're talking about Trump, about WHO, about China, about politics. I think we need to have a goal of stopping the spread of this virus and doing it in the context of leading the most normal life that we can, to be as safe as we can and being as normal as we can. And this is doable. Now, we can argue whether something is overdone in terms of suggestions and things that are underdone. My opinion, which is based on reading a lot and studying a lot and watching what's going wrong in some places at this moment, is that I don't think these bars should be open. Sorry, I do not see that. I mean, there's like a joke of a virus walks into a bar. I mean, this is in really what is the most serious pandemic in 100 years. which is in an early phase. This is an incubation chamber. And I do think there should be more mask wearing. And then let us get through.
Is there any science behind the masks? Is there any science behind mask wearing?
God, yes. Yes, absolutely. It reduces transmission in the hospital. It reduces transmission within the home from someone who has it. And it also improves the whole situation of a community and a country.
Well, I'm not talking about the psychological benefit. I'm talking about in terms of disease.
No, I wasn't either. No,
okay.
I'm talking about the spread of the virus.
Okay. Do you have any?
Droplets are stopped by the mask, and very, very effectively. And for you yourself, if you're wearing a good mask or you're doing it right, they will prevent the much of the spread to you.
I'm looking at more than a dozen studies from medical journals like Epidemiology and Infection, American Journal of Infection, Influenza and Other Respiratory Viruses, Clinical Infectious Diseases, Volume 65, Issue 11, December 2017, and all of these studies draw precisely the opposite conclusion to what you're suggesting. But you say there are studies out there that
it's not accurate, Dan. It's not accurate. I don't know what you're referencing. If there's 40 studies about masks, 30 of them are going to show an effect. And it's shown in the home, it's shown in the hospital, it's shown in the community, and it's shown at country level. And it makes biological sense because it's being spread from one person's mouth into the air, into another person's nose and mouth.
2019 study published in JAMA, N95 respirators versus medical masks for preventing influenza among healthcare personnel. And conclusion.
No, wait a second. No, you're talking about medical masks. Now, in the healthcare setting, they really need the medical masks or the surgical masks. In the other setting, believe me, the medical masks and everywhere else, the medical masks and the surgical masks are better too. They're still trying to keep those better masks for the healthcare providers because they don't have enough.
One last question, just going back to, you talked about non-lockdown states versus lockdown states and, the non-lock states being more rural. Well, what about rural areas within states? I mean, should we do this on a community basis too? Because, for example, in Illinois, where you have a metropolitan area in the Northeast and then the other 2/3 of the state is rural, there's been a very different experience. And in point of fact, cases and hospitalizations and deaths topped out about 2 months ago, and yet the governor of Illinois treated the entire state the same, and that seems to be not sensible and not based on science or data.
Well, he's probably basing it on science and data, but your point is still extremely relevant, and because everything is very local. I mean, even within Chicago, and that's why we really need to be spread. Even within Chicago, where the city as a whole now is going down in terms of new cases, but the area where I'm living, it's going up. And you can look by zip code. And why is it going up in the area where I'm living? It's probably because of the bar use by the young people. But you can see the percent test rate and the number of new cases is going up. So what you're pointing out is very important. It's very hyper-local. And also some of the places that you're talking about that are rural and more highly spaced, they are less likely to have a problem, but then they can get problems. And so they have to be watched. Everybody needs to be watching what their trends are and dial forward or dial back based on what's actually happening. And this is not a stable process. It's a dynamic process. That's what the word epidemic is about. You put 10 people in a bar, and then suddenly you've got 10, and then you've got 30, and then, there's all kinds of things that spread from such incubation points.
All right, we're gonna have we're gonna have to leave it there, Doctor. But I do appreciate you indulging me in my animated sense and animated self. I appreciate it. Dr. Gary Slutkin, physician and epidemiologist. He's led efforts to combat epidemics of tuberculosis, cholera, AIDS. He's a former director of intervention at WHO and currently tracking and advising governments on COVID-19. He's also the founder of the organization Cure Violence. Dr. Slutkin, thanks again for joining us. Appreciate it.
I appreciate the interaction and the interchange with you very much, Dan. Enjoy it.
Thank you. And he joined us on the Turnkey.Pro answer line. Coming up at 8:38 for something completely different. Adult entertainer and contributor to The Federalist. Why she supports President Trump's reelection.
I hope you do that interview.
Okay, there's no
Because
there's no shortage of punchlines to that statement.
I'm just going to take a step back.
Okay.
I have dignity, sir.
Well, that's what separates
I'm a journalist, sir.
us. Well,
Have you no decency, sir?
we discard dignity at 8:38. Now we check the headlines with Mike Scott.
78 degrees. U.S. economy adding 4.8 million jobs in June, almost a full 2 million more than expected. Jobs in the leisure and hospitality industry rising sharply, including gains in retail and health services. Lawmakers from both parties will be briefed by the CIA today about the alleged Russian bounties on U.S. troops. Officials in Myanmar say a land